Hi, this video is the art of hair transplant restoration surgery on a client who has a receding hairline and corner. And our goal is to lower hairline, recreate the hairline, and fill in both corner. Hair transplant, there's a couple ways to do this. There's a Mickey Mouse way, we just fill in the corner and leave the front alone. Or the right way, where you can recreate the hairline where artistically and aesthetically looks natural. So the main idea is the hairline has to flow. So just fill in the corner and it looks a little bit interrupted. So to do it right, you have to make sure it flows down. And so we're not just lowering the both corner, but we have to lower the front a little bit, as long as not too low. And then when it comes down, the idea is from the mid eyebrow to the hairline. Is for Asian and black around 6.5 to 7 centimeter. For Caucasian around 7.5 to 8.5. As long as overall proportional to a third. Mid eyebrow to the hairline is a third. Mid glabella to the tip of the nose is a third. Tip of the nose to the bottom of the chin is a third. The more narrow the face, the more arched back the hairline is. The more round the face, the more flat the hairline is. What you see the line is actually an imaginary line, because there's no straight line. So it's a median really, and we're dancing up and down it, so the line is not there. And the more zigzag the line, the bigger the zigzag, the softer the hairline is. The smaller the zigzag, the tighter the hairline is. Or you can go somewhere in between. So there's two types of hairline. Soft hairline, we use a bigger zigzag and a lot more single hair root. Then the hairline looks natural, but it looks a little bit thinner, versus the tight hairline where it's a smaller zigzag, and so the amount of roots that go single hair is less, so it gives more of a wow factor. I'm not going to give you an abnormal hairline or a hairline that doesn't look natural, but a lot of people say let's go in somewhere in between. That's fine. Once we get the shape down and the zigzag down, we will transplant a very precise angle, 35-45 in the front. Increase when you go backward, and changes when we go in a different direction. And not only the precise angle is important, the selection of hair graft is important. We transplant rows and rows single hair graft in the front, followed by root to go 2 hair, root to go 3, root to go 4 in the back for bulk and volume. The goal in the front is softness and naturalness, and you don't want no harsh roots and thick root in the front to look unnatural. The goal in the back is volume and density, so you want root to go bigger roots in the back. So this is the art of hair transplant restoration surgery using the FUE method, and we will be doing at least 1,500 to 2,000 grafts for this client. And the more hair you put in, the lower the hairline is, the more density you get. And not only that, the more further back we go, the further reinforcement we do to anticipate the future hair loss. The reinforcement is very important, because we're not only filling the bald spot, but we go backward and we'll go back more and go back. And why? Because when we shave the head, we can tell how thin the area is and how thin the hair is. We'll anticipate that for the hair loss in that area. And the more hair you put in, the longer it takes for you to come back for another surgery. Now there's two techniques to harvest the hair graft out. There's only one technique to put them in. That is one follicular unit transplant at a time. But two technique called the strip method versus the FUE method. The strip method or the FUT is fine. The strip method will cut out the strip of skin in the back and suture you up, leaving you a linear scar. The FUE method is pulling one root at a time. Now I do both methods. So the majority of the time nowadays, the strip method is fading out, but it's still very effective and it's very important. The strip method, if a client would have massive hair loss, an advanced hair loss, class 5, 6, or 7, where you lose all the hair, and you need to move like 5,000-6,000 grafts per day, the strip method is very effective for that. Versus the FUE is good for a case like this with mild to moderate hair loss, class 3 or 4. And you can do that. Now, you can do the FUE on the advanced hair loss, but you're going to take quite a bit of more surgery. You take 2, 3, or 4 surgery. And the cost is a little bit more too, not just the time. And where the strip method with advanced hair loss, you reach your goal fairly well with 1, if not 2. And depending on how perfectionist you are, then you might get this 3. But again, because the strip is effective for advanced hair loss, mild to moderate hair loss like this, FUE is the way to go unless you just want to save money, then go with the strip method. FUE is not just less invasive, it's a lot less side effect, less painful during recovery, less bleeding, faster healing, and it leaves tiny dots of scar and it's become less visible, allow you to wear your hair shorter. The strip method, the scar can be very small, but it's a little bit more invasive, and more people are not using the strip unless it's an advanced hair loss. And again, I do both method. Both surgery produce scar, but they produce different form of scar. And the question you always ask yourself is the price, of course, number one. And number two is, if the leading scar, can you live with the leading scar for the rest of your life? If you can answer that two question, then it'll help clarify and help you to decide which methods is better for you. I'm very excited for this client because in a year time he will look completely different. So this is the art of hair transplant restoration surgery, and he's thinning a little bit toward the back, so he's gonna need more surgery in the future. And he knows that, and we'll be at least doing 15 to 2,000 today for now. Thank you.